Well, good morning, everyone. On behalf of Silver Cross Hospital, I would like to extend a very warm welcome to Governor J.B. Pritzker, Lieutenant Governor Juliana Stratton, the elected officials in attendance today, Illinois Hospital Association President A.J. Wilhelmy, members of the media, and representatives of our Silver Cross Hospital medical staff, leadership team, and hospital staff. I'm Scott Paddock, Senior Vice President of External Affairs at Silver Cross, and we are extremely honored and proud that Governor Pritzker chose Silver Cross as one of the hospitals he's visiting this week during his statewide tour in support of his groundbreaking Healthcare Protection Act. Silver Cross Hospital fully supports this important legislation that would curb predatory insurance practices and put the power back into the hands of patients and doctors where it belongs. Thank you, Governor Pritzker, for introducing this legislation that will, among other things, ban step therapy, eliminate prior authorization for crisis mental health care, lower health care costs for patients, and save lives. We at Silver Cross applaud the Illinois House, which passed the Healthcare Protection Act last week, and we urge the Illinois Senate to do the same. At this time, I would like to welcome Governor J.B. Pritzker.
Thank you. Well, good morning, everybody. It is great to be, you're a little taller than I am, so. Good morning, everyone. It is great to be here at Silver Cross and among all of you, and thank you for all the hard work that you do here, and very importantly, for hosting us this morning. It's an exciting day. We're here to highlight the Healthcare Protection Act. It's a bill that, if passed, will help us curb predatory insurance practices and empower patients and their doctors. I'm joined today by Lieutenant Governor Juliana Stratton, by New Lenox Mayor Tim Balderman, Mayor Terry Darcy of Joliet, County Executive Jennifer Bertino-Tarrant, Representative Anna Muller, who is the chief sponsor of this bill in the House, Senator Robert Peters, the chief sponsor in the Senate, Senators Mike Hastings, Patrick Joyce, and Rachel Ventura, Leader Natalie Manley, Silver Oaks Group Chief Medical Officer Dr. Imran Shakir, and IHA President and CEO A.J. Wilhelmy. Last week, the Illinois House passed the Healthcare Protection Act, whose purpose is to make quality care easier to access for patients across Illinois and to increase accountability by insurance companies. For far too long, insurance companies, not doctors, have been free to determine what treatment options patients should have and how quickly they can receive it. With this bill, we're putting power back in the hands of doctors and patients. The HPA starts out with a focus on utilization management. Too many patients get hit with an unexpected roadblock when they're forced to wait a long time for permission from their insurance provider before they can receive care, all the while dreading the possibility that their request will be denied. Too often, utilization management results in a denial of coverage because insurance companies simply want to boost profits. It's an unhealthy and unfair system for patients. Utilization management comes in many forms, but it's most often seen prominently in prior authorization and step therapy. Prior authorization forces consumers to get approval from their insurance company before beginning treatment, even after the doctor has deemed the treatment medically necessary. And with step therapy, insurance providers can require patients to try and fail on often less effective treatment options and medications first before getting the actual care that was recommended in the first place by their doctors. There's no question that medical professionals are better suited to make recommendations about treatment than insurance company bureaucrats. So with this bill, we're requiring insurance companies to use the same treatment criteria to determine medical necessity that doctors do. That way, patients get what they need. And we're banning step therapy in Illinois for fully insured and Medicaid plans. The Healthcare Protection Act will also make Illinois the first state to ban prior authorization when it comes to inpatient, hospital setting mental health care, because those in crisis should never be forced to navigate difficult insurance policies. When shopping for healthcare coverage, it's important that insurance companies be transparent about prior authorization so consumers can make informed decisions when purchasing coverage. That's why HPA requires that insurance companies publicly post every treatment that requires prior authorization. We're protecting consumers further by prohibiting insurance companies from selling what are called junk insurance plans, which don't even meet the minimum standards of the Affordable Care Act. By doing so, we're joining a growing number of states, 12 so far, and it's time for Illinois to join that group. The second focus of the Healthcare Protection Act is on improving network adequacy. We're setting a standard for care availability, including appointment times and in-network doctors. We too often, see problems with in-network directories and their listed availability. When a patient goes to look for a provider, the list may show doctors and specialists that no longer accept new patients or aren't any longer in the network, or sometimes don't even exist at all. These ghost networks make it even harder for patients to locate care nearby without waiting weeks or months for an appointment. To combat this problem, our bill requires that insurance companies regularly update their provider directories to show the true availability of healthcare providers. And finally, this bill, with it, we are continuing our efforts to prevent insurance companies from gouging their customers by unfairly hiking up their rates. Last year, my partners in the General Assembly and I ended these unfair rate increases for individual policyholders and the small group insurance market. HPA this year requires large group insurance carriers to follow the same rules. The Healthcare Protection Act is a set of consumer-focused health insurance reforms that will return a sense of autonomy and control to patients and their doctors. Now, we're protecting Illinois families, making it easier and less labyrinthian to navigate the world of healthcare and insurance. I also want to shout out my partners in this endeavor, and I've mentioned two of them already, but this bill's two outstanding sponsors, Senator Robert Peters and Representative Anna Muller, are working incredibly hard to advocate for Illinois families, and I'm so grateful for their leadership. This bill sailed through the House of Representatives under the leadership of Anna Muller with bipartisan support, and I think that's important to recognize. It doesn't matter what party you belong to. You've been subject to issues and challenges that we can now deal with the Healthcare Protection Act. I also want to make sure that you all know that when I mentioned this, and I talked about this during my State of the State address just a couple of months ago in February, I told you that I'd put my shoulder to the wheel to get this done, and I meant it. That's why I'm here in New Lenox, traveling to communities across the state to tell Illinoisans about this legislation. From Belleville to Peoria to Rockford to Maywood later today, we're talking with doctors and patients and consumers with this one message: this bill will save lives, and it will lower healthcare costs for millions of Illinoisans. Together, we'll get this bill through the Senate under the leadership of Senator Robert Peters, and we'll land it on my desk where I will proudly sign it, because the people of Illinois deserve reliable and safe access to quality care. And with that, I'm proud to introduce our House Chief Sponsor, Representative Anna Muller.
Good morning. Well, I am very grateful to be part of this effort, with the strong leadership of Governor Pritzker and Lieutenant Governor Juliana Stratton. We did get this bill through the House last week, but we would not be where we are at with this legislation if it were not for his incredible leadership and the expert negotiation and drafting and work that his staff undertook over the past several months. The governor really deserves so much credit for bringing this forward. It's wonderful to be joined here this morning with my General Assembly colleagues. It's great to see Senator Hastings and Ventura and Senator Joyce and my colleagues in the Illinois House who supported this bill, and we would not have been able to pass this without their support and leadership. Leader Manley, Representative Walsh, Representatives Meyer Martin, Representative Avilar, who are here with us today as well. And thank you so much to Silver Cross Hospital for hosting us. Thank you to all of the doctors and nurses and staff who provide that on-the-ground care for patients in this area. I truly am grateful for all that you do, the sacrifices that you make to help people and help them stay healthy in our state. I was delighted to pass the HPA last week in the House. Governor Pritzker did a fantastic job explaining the details and the elements that are included in this legislation. And as he mentioned, this bill was introduced to the state during his State of the State address in February. It started through the legislative process in the Human Services Committee that I chair back in early March, and we held a subject matter hearing on the legislation to give committee members and legislators an opportunity to truly understand what the challenges are with the current state of insurance and how patients and doctors struggle with the barriers that have been put in place by the insurance industry to increase their profits. So we brought in doctors, we brought in patients, we brought in advocates, and we heard incredible stories, human stories about why this legislation is so important. We heard from a doctor who works in an emergency room, and because of requirements for prior authorization, before a patient can be admitted for a mental health crisis, has seen time and time again people showing up at their hospital, at the emergency room, truly suffering in acute crisis, having to be turned away because an insurance company would not allow them to be admitted because of prior authorization. And the anguish that this doctor felt knowing that this person could end up hurting himself or hurting others because of the arbitrary rules put in place by an insurance company. We heard from a patient who bought one of these short-term junk policies that we are banning in this legislation, who was diagnosed with MS after purchasing this policy, thinking that he had a policy that would cover these types of conditions, and only to find out that this insurance company, the short-term insurance company, would not, or policy would not cover MS because it was a pre-existing condition, even though he had never been diagnosed with MS before. It was very eye-opening to hear these stories, and that's why I'm so proud that we are bringing this legislation forward. Both of those practices and the others that the other elements that the governor explained are truly going to prevent so many tragedies in our state. They're going to help you serve and treat and care for your patients. It's going to create a healthier Illinois, and I really look forward to this getting through the Senate. We were very pleased to have 10 Republican votes on this legislation, which is no small feat. We had a Republican co-sponsor on this legislation. So now the gauntlet has been thrown for the Senate. We want to see a good bipartisan roll call in the Senate as well, which I know we will because we have an outstanding leader who's going to bring this forward in the Senate, Senator Robert Peters, who I am very happy to introduce and call to the podium now. So thank you so much.
I appreciate at every press conference I'm told about what I have to accomplish to make sure that this bipartisan bill is happening in both chambers. I'm State Senator Robert Peters of the 13th District, and I just want to say amazing work by Rep. Mueller and members of the House and the advocates for getting this bipartisan bill out of the House chamber. We are one step closer to bringing comfort and dignity to healthcare patients all over the state. I am no stranger to our healthcare system. I was born hard of hearing. I've had multiple surgeries throughout my life. I've struggled with mental health issues. I've seen these struggles with friends and family. And in my 20s, I've lost one parent to cancer and another to alcohol abuse due to her coping with her own mental health trauma. Like so many of my constituents, I know the anxiety and fear that comes with navigating our healthcare system, especially right now as my wife and I are looking to have children in the near future and are doing fertility treatments. And I just want to give a shout out to Senator Hastings for passing his IVF bill out of the Senate a couple weeks ago. It is hard enough trying to navigate the day in and day out of life, whether that is taking care of friends and family, taking care of work and home chores. It is understandable that a bunch of healthcare papers and policies can add even more anxiety to your life. I have a unique district. It stretches from downtown Chicago through the south side to the Indiana border. It is home to large health systems, a public health system, safety net hospitals. It is also home to people who live across spectrums, particularly across race, class, and gender. But one thing that is nearly universal is people who have felt pain when it comes to their health insurance. I was going to insert some joke. I went to Mount Carmel, some Providence jokes since we're in New Lenox. I'll just scrap it. What we are doing here is fighting for the everyday Illinoisan, the one who wants to make sure that their loved one or even themselves is receiving the best care possible. That when your doctor recommends a treatment, that is the treatment that you get. That when your child is facing a mental health crisis, they get a hospital bed that is filled with love, safety, and comfort. That finding a provider or a plan isn't a guessing game for your well-being and your wallet, and that you aren't fooled by predatory companies masquerading their financial scams as insurance plans. This bipartisan bill is coming to the Senate, and the big-time insurance companies are going to do all they can to fight back. They're going to throw out every scare tactic in the book, and we have made it clear. The door is open, and that advocates as well as opposition are able to give input on this bipartisan bill. And just want you to know they have given input. Everybody has. This is the process, and it's been amazing work by the governor's staff on this. What we've done and what we are doing is bringing the people of Illinois with us to the negotiating table. We will get this done. We'll continue to make Illinois a healthier and safer place. And I'll end on this. Thank you, Governor Pritzker. I'm honored to sponsor this bill, but I know I am not alone on this. So many leaders and colleagues have worked tirelessly and personally to change and improve healthcare outcomes in the state. When we get this done, it will have been all of us who have been committed to our constituents and ensuring they have the best care possible. Next up, I would like to introduce my good friend, a champion for the Southland community, Senator Mike Hastings.
Good morning, everyone. First, I want to welcome everybody to the 19th District. I'm very grateful to the residents who have allowed me to serve you for the last 16 years. I want to say, Mayor Balderman, thanks for letting us in the New Lenox. The Fortress of New Lenox is a great place to live, and I'm looking forward to the development across the street here. I want to say thank you to Silver Cross Hospital, to Mike Mutter, who's our interim CEO, and to Scott Paddock, and most importantly to our doctors and our nurses that are here today. Ruth is looking down on us today, and she's looking down and she's saying how proud she is of all the work that you've done and all the work that you're doing, and we are truly in a blessed place to work, so thank you very much. I want to welcome Governor Pritzker. Not too long ago, Governor, I remember driving in a car with you to the Joliet Speedway for an organized labor breakfast, or having you at our local pizza parlor with a couple hundred of our closest friends and family, learning a little bit more about you. And the one thing that Governor Pritzker did is he made a commitment. He made a commitment to my friends, he made a commitment to my neighbors, and he made a commitment to my family that he would be back. It's nice to see you back in our neighborhood, Governor. And more importantly, it's great to partner with you on such an important piece of public policy. So thank you very much for that. Today marks a pivotal moment in our healthcare system. It's where we're advocating to choose people first over insurance company profits. It's essential to underscore the fundamental principle here. Patients' needs must come first. Last November, I hand-wrote a law before it was politically popular and before it became a national news headline, because what was occurring was simply wrong. It wasn't right, and it was part of the foundation of why we're here today. So let me share a personal story with you that deeply resonates not just with me, but with other families across the south suburbs in this cause. My daughter, Maddie, who some of you have known when you guys were taking care of my family here, she ran around the hospital. She was brought into this world through in vitro fertilization. Her arrival has brought unlimited amounts of joy to my family and to a lot of other people as well. It was a journey, though, that was riddled with uncertainties, delays, and bureaucracy. It put an immeasurable amount of stress onto our family, and any delay in treatment would have altered the course of our lives well into the future. Across our state, there are insurance companies who dictate not only to women, but to families across the state of Illinois as to what their treatment plan should be, whether it be for in vitro fertilization or any other healthcare treatment, that being mental health or cancer, ultimately ignoring a doctor's recommendation. If a doctor says a family should go through in vitro fertilization or another medical procedure, an insurance company should not say, well, you got to go through steps 1 through 10, and then we'll talk about it, ultimately delaying the blessing of having a child or seeking any other mental health treatment or medical treatment for that matter. And this happens every day here in Illinois. When insurance companies' profits and policies supersede the most important parts of the equation, that being the doctors and our people, that's a problem. So whether it's a neighbor, a member of our staff, even legislators who we don't see eye to eye with, the bottom line is that insurance companies don't discriminate when it comes to making a profit, and families should not have to live beholden to their insurance company when it comes to family planning, reproductive rights, or any other treatment plan that's prescribed by a doctor. I'm just going to say it the way my neighbor said it. The insurance empire bureaucracy is a nightmare. And I get a lot of up and downs in the crowd because you all agree. By championing this legislation, we're taking a critical step towards healthcare systems that prioritize patients' well-being over the bureaucratic red tape. Together, let's ensure that no family has to encounter these needless delays when it comes to accessing healthcare that they desperately need. So I thank you again for allowing me to represent you, to be your senator. My door is always open to you, so thank you very much. And next up, I want to introduce my little guy's Park District pal, his bocce ball partner, my colleague, and somebody who I can truly say is my sincere friend. I want to introduce Senator Patrick Joyce.
I don't think I've ever had that kind of introduction. Interesting. When you look up my Senate bio, one of the things that's been on there since I became a senator was patient advocacy in the healthcare system. I'm thankful every day for the network of family and friends that my wife and I have. This network is what sustained us through some very difficult times with our 2 youngest children. In 1994, my son was born with truncus arteriosus type 3. There's a few doctors that might know what that is. It's a rare heart malformation that required open heart surgery at 2 weeks old, again at 4 years old, and yet again at 14 years old. Countless MRIs, echocardiograms continued. He had a melody valve at the age of 26. He's currently 30. We know he needs continual monitoring, and yet pre-authorizations are necessary for insurance coverage. His condition is not changing. These cardiologists required tests set benchmarks as to the urgency of his next procedure, period. He is examined on a regular basis by trained professionals. Pre-authorization again and again can be very frustrating. When we thought our prayers were answered and tough times were behind us with our son, our daughter was diagnosed with AML leukemia in 2010. 7 chemo treatments, 2 stem cell transplants, surgery and radiation for brain tumors, and a 2-year battle in hospitals more than out, found us fighting for coverage and pre-authorization for better nausea medications, injectable blood thinners, an MRI here, another day in the hospital there. Our fight to keep her morale up, to stay strong, we're divided to fighting for better medication and different procedures. We saw how effective a nausea medication was after chemo number 2. And when chemo number 3, severe nausea, landed my daughter in the hospital for 4 extra days, we were told that that medication wasn't currently authorized. It took years to sort out the coverages after Katie passed. If you don't have a network of family and friends, I refer you to the beginning of this testimony, who advocates for you. You're out there by yourself. This piece of legislation is a step in the right direction to advocate for Illinoisans' healthcare needs, and I appreciate it being brought forward. I want to thank Silver Cross Hospital. Both of my kids, through your partnerships with Lurie's and Northwestern, have had procedures and benefited from your location. I appreciate everything you do. Thank you very much. And I would like to now introduce my colleague, Rachel Ventura.
Good morning. My name is Rachel Ventura, Senator in the 43rd District, which covers Joliet, Bolingbrook, Lockport. For too long, insurance has dictated health care, but I'm not sure we should call it health care if it denies care in the name of profits. So I want to give you a peek behind the curtain on the other side. When I finished school, I got my degree in mathematics, and I went and worked for an insurance company. I initially worked for health insurance and then later life insurance on my path to becoming an actuary. My job was to look at the data all across the networks that we had, a lot of them being here in Illinois, and decide on zip code and doctor rates and hospital rates. Was this a hospital or a provider that was worthwhile to be in our network? And what that meant was I had a standard in which I had to decide, could we make enough money off of this? If we didn't even come close to breaking even, we immediately dropped those providers and hospitals. In some areas of the state, that could completely put a hospital out of business. In other areas, our standards needed to be well above 20, 30, 40% profits. That was 20 years ago that I worked for an insurance company. I left that field because I felt I was selling the parts of my soul away for somebody else to make trillions of dollars while we denied coverage to people who really needed it. So I am very much in support of this bill. I want to tell you a story that just happened last night. Someone who was telling me, and I'd like to say that this is a rarity, but unfortunately I hear stories like this all the time. So last night I met a woman who was telling me that she was 10 years sober from a substance abuse. And I was so congratulated for her, and she was telling me her story and her process and all the health care and the mental health that came about. And now 10 years later, she needs to have a routine procedure, and it needs some pain medicine to it. And so when she was working with her doctor and said, the 2 medicines you want to give me for this procedure would put me back on a path that's taken me 10 years so that I can be sober. And the doctor said, I will work with you. We will get a general anesthesiologist in here to help you in this journey. Only to find out that her insurance denied that that was not the step that she needed to go through. She needed to use this medication. Now, there was no way that insurance company knew that woman's personal story and the journey that she had been on. But her doctor knew it, and the staff knew it, and they were willing to work with her from a human level of really providing the health care that she needed. That is what this bill is going to allow us to do. Give the power back to patients, to doctors, to their staff, who can make those decisions that are best. It is time that insurance stops practicing medicine without a license, because that is exactly what they have been doing. So I highly support this bill, and with that, I'd like to introduce Leader Manley. Thank you.
Good morning. I am truly honored to be able to stand here with all these great leaders fighting to make healthcare better and more affordable. First of all, happy Administrative Professionals Day. And happy April is Autism Acceptance Month, so happy Autism Acceptance Month. Too many families have felt the crushing financial pressure caused by harmful insurance practices. Every denied claim is a life hindered, a treatment delayed, and a family burdened. Fighting with an insurance company while you're fighting for your life is cruel on every level. Because of the hard work and unfettered determination of this guy, who I can't even tell you, I'm like the biggest fan of Governor Pritzker. He is truly, and I'm totally off script now, sorry. He is truly a champion for every person in Illinois. We saw him lead us through a pandemic, keeping number one, first at the top of his list, the health and well-being of people. This is just another example of that, and we're just getting started. Thank you to the governor for your unfettered determination, the talent that you've put around you to help us get this done, to Anna Moeller, who did a masterful presentation of this bill on the House floor. I've never seen anything like it, quite frankly. Sorry, hopefully Senator Peters will be able to step up and do the same. I like doing that to him. We're sending a clear message here today. We're just getting started. There's so many things that need to change. I'm proud to stand here with the governor, his team, the lieutenant governor. Thank you to Silver Cross Hospital and all the people here today. I think we're in good hands all the way around. Thank you, everybody. And now I'd like to introduce Dr. Shakir.
All right. Good morning, everyone. First and foremost, thank you so much for the opportunity to advocate. My name is Dr. Imran Shakir. I'm the Chief Medical Officer over at Silver Oaks Behavioral Hospital and Chicago Behavioral Hospital. Together, we own 3 inpatient psychiatric facilities in Illinois, and we have about 450 inpatient psych beds. And I'm very, very, very proud to say that we've had the pleasure of taking care of thousands of Medicaid lives over the years. It's something I'm very passionate about, and I just can't thank the governor and all of the representatives here who are taking this up. You know, Michael called me last week, and he said, "Hey, Dr. Shakir, how would you like the opportunity to advocate for Medicaid?" Yes. This is so amazing to be able to do in our home, in our backyard here at Silver Cross. So, being a psychiatrist, seeing these patients day in and day out, we know their struggles, we know their illnesses, and unfortunately, we also know their payers. And myself and my colleagues, we sit down together and we wonder, how did it get this way? How is this okay with anybody? The way Medicaid behaves, managed Medicaid behaves in this state. I'll give you a story that I hear all the time on the inpatient unit. Once you get hospitalized on an inpatient unit, something terrible has already happened. It's already too late. Someone has attempted suicide. Someone has taken steps to end their life in a very meaningful way. Maybe they've made threats against a school because of their illness. Maybe they're psychotic. Maybe they're going through a manic episode, and on and on and on. And I can't tell you how many times patients say, "Doctor, I've been trying to get care. I know I'm sick. I've picked up the phone and I've asked, when can I be seen?" And they get a wait list, 6 weeks, 8 weeks, 12 weeks, depending on where you live, 6 months. So they decompensate. They live with their illness. They do the best that they can. They're not on Medicaid from choice. Their illness is robbing them of their function, so they cannot work. They cannot be in a full-time position where their employer can subsidize a fancy commercial insurance plan. And then they try to get treatment, and they're told no. And there's prior auths and ghost networks. It's hard enough as a, depending on who you talk to, fully functioning adult to try to get mental health care. Now imagine if you can't get out of bed in the morning because you're so depressed and you're asking that person, "Hey, pick up the phone. You should see somebody." Pull up the network list and none of it is accurate. You pick up the phone and try to see a doctor. "Oh, we haven't taken this payer for years. Why are you calling us?" And then the patient finally gets into the hospital after living with their illness. And again, something terrible has already happened. The payer says, well, you have 72 hours, doc. The clock is ticking. What am I to do for a patient who just attempted suicide yesterday in 72 hours? Those wait lists are still there. All that adversity that the patient faced that has led them to where they are today is all still there. There's so many pieces that still need to be picked up. After an attempt, family work, working with their employer if there is one, figure out a medication regimen, arranging aftercare, and on and on and on. And then to have to pick up the phone after 72 hours after hearing that care has been denied due to prior authorization. And I'm told I have to speak to my peer on the phone, someone who has never seen this patient, someone who has only read the notes that we provide them, and for them to say, doctor, I'm sorry, I disagree. This patient needs to be stepped down to a lower level of care. Lower level of care what? The patient is here because they haven't been able to engage with the lower level of care up to now. So here we are. And again, how does a system get this way? And the only thing that's ever made sense to me is we're putting profits over patients. Right? That's how we arrive here. That's the only way we arrive here. And time again, those that that are least beholden to our patients and least beholden to their outcomes hold all of the cards. And again, you know, I can't say this enough. It is a breath of fresh air to see legislation like this proposed. It is a breath of fresh air to see passion from my elected representatives about such an important issue, because this is adversity that our patients face every single day. So thank you, Governor. I hope it's very clear we're very, very, very much in support of this legislation, and I truly hope this inspires much more. With that, I'd like to introduce our IHA president, who's been a wonderful advocate for our hospitals and the docs, AJ Wilhelmi. Thank you.
Good morning, everyone. Thank you, Dr. Shakir, and thank you, Governor Pritzker, for the opportunity to join you today and for your outstanding leadership on this issue. I'd also like to recognize Michael Mutter, Scott Paddock, and the entire team here at Silver Cross Hospital. I want to thank you for hosting us this morning. On behalf of IHA's 211 hospital members, I applaud the efforts of Governor Pritzker and his administration, as well as Representative Moeller and Senator Peters, and our fantastic local representation in the Illinois General Assembly for advancing this important legislation on behalf of Illinois patients and their families. And we saw significant bipartisan support for this bill in the Illinois House, and now on to the Senate. And Senator, you got this. For years, we've heard from our member hospitals that prior authorization, delays, and denials are a top challenge in delivering timely and appropriate health care, especially when it comes to critically important mental health services. And that's why IHA has welcomed the opportunity to work with the Pritzker administration on this proposal that would prohibit prior authorization for inpatient mental health admissions for the first 72 hours and thereby ensure patients receive the specialized mental health care that they need and deserve. The hospital community also supports provisions in this bill that would ensure healthcare professionals are the ones making the final decisions when it comes to their patients' medical care, not insurance bureaucrats. Practices that allow an insurance company to override a physician's judgment, these are cost control strategies that benefit the insurance company's bottom line at the expense of the patient. This proposal places patients before profits by making sure healthcare decisions are made with one goal in mind, and that is to advance better patient care and ultimately better health outcomes. Governor, you said it so well today and in your State of the State address, we must put the power back into the hands of patients and their doctors, and this proposal begins the process of doing just that. So on behalf of our member hospitals, our healthcare workers, and most importantly, the patients that our hospitals are privileged to serve, IHA applauds the governor and the bill sponsors for moving this important bill forward. This legislation will empower the Illinois healthcare community to deliver the best possible care for their patients, and we stand strong support of this legislation. So thank you, and now it's my pleasure to introduce the great Lieutenant Governor Juliana Stratton.
Hello, everyone. I'm Lieutenant Governor Juliana Stratton, she, her pronouns. In the interest of time, I'll just say thank you to all of our incredible partners in the General Assembly and all of the other elected leaders joining us today. It's so great to be with you here in New Lenox. And thank you to everyone from Silver Cross for the warm welcome. I'd like to start by thanking Governor Pritzker for continuing to prove that strong leadership doesn't have to sacrifice compassion. I also want to thank Representative Moeller and Senator Peters for leading the charge to advance this important bipartisan bill through the General Assembly. You know, though America is struggling with division, we are united by at least one thing: a collective fear about the skyrocketing cost of health care. In 2022, a little more than 65% of Americans reported having private health insurance coverage. But having insurance doesn't guarantee that coverage will, in fact, cover you when you need it the most. Due to loopholes, sneaky coding, and sometimes just plain bad acting, it's hard to find many people who feel confident that their insurance provider has their best interest at heart. The work we're uplifting today marks the beginning of a new narrative in Illinois. The Health Care Protection Act interrupts the status quo of predatory practices and instead returns power to patients and their doctors. This is not just a matter of access, though. It's also a matter of equity. A 2022 study of cancer patients found that Black patients were 3 times more likely to have been denied health insurance because of their diagnosis than white patients. We cannot allow any system to function in a way that deliberately leaves people out. And I'm grateful for the dedicated health professionals, many of you in this room today, for standing with us in this fight. Every single person deserves care without adding stress about whether or not a faceless analyst at an insurance company will deem their doctor's prescribed treatment necessary. Let it be known that Illinois doesn't give up. We hear our people's pain, and we see the gaps that allow their pain to persist, and we'll do everything in our power to deliver relief. And I'm beyond proud to be a part of an administration that values humanity and health over profit. Thank you so much. With that, I'll ask the governor to come back to answer any questions from the media. Thank you.
Happy to take any questions from members of the media.
Sure. Hey, Governor. So we reported last night that the Chicago Bears are planning to unveil a $4.6 billion stadium project. Half of that money would be, the Bears have pledged to put up half of that money, $2.3 billion, and the other half Illinois taxpayers would be on the hook for. There hasn't been an official announcement yet. That's going to happen probably in about an hour and a half. But based on all the information that's out there about this, including any information you might know personally behind the scenes, what's your reaction to this plan?
Well, let me start out and say I'm a Bears fan. But, you know, before I became governor, I was a businessman, and I've tried to be a good steward of taxpayer dollars throughout my term in office. And as you know, I've been very active at attracting businesses to Illinois and helping companies in Illinois expand. So that's something that I do with, again, the role of a protector of the Illinois taxpayers' dollars in mind at all times. But I remain skeptical about this proposal, and I wonder whether it's a good deal for the taxpayers. It's early on, have not even heard the announcement today, but obviously read your reporting and others. But it's very important to me that with all that the state needs to accomplish, that we think about what the priorities are of the state. Here we stand talking about the Health Care Protection Act. Later today, I'm going to be talking more about birth equity and helping to build birth centers in areas of the state where people don't have options for for giving birth that are outside of hospitals, and that requires capital. There are a lot of priorities that the state has, and I'm not sure that this is among the highest priorities for taxpayers. So,
obviously, because you've said that a lot about priorities of the state, including why we're all here today, with healthcare.
yes.
And how, the high cost of that. And we've been down this road before with the Bears and the White Sox with, it's been taking years and years for that debt to get paid off on Soldier Field and now Guarantee Rate Field. Going forward, because I know you've also said you're open to listening to proposals from sports teams. What would it take to put the Bears over the finish line with this? Given, and are there any lessons learned from the last 20, 30 years and state government's familiarity with this topic?
Well, maybe one lesson that could be learned just from the last few years is stadium deals and taxpayers putting money forward for stadium deals, not particularly popular around the country. Take note that the winner of the Super Bowl this year, the team went out to try to get a stadium financed by the public, and it was rejected by the public in a place where the Super Bowl champions reside. And I think this is, a recognition that these are private businesses, that the owners of these private businesses need to put a lot more forward in order to get, have their dreams fulfilled and not just rely upon the taxpayers of Illinois to make that happen for them. Having said that, I think all of us want success for the state. We want, more commerce. We want more jobs. We want our teams to be successful. So we share all of that in common, but we've got to use our dollars wisely.
Anyone else?
Yes, ma'am.
Hi. Going back to the healthcare issue, does the
Thank you.
Does the Healthcare Protection Act have any sort of provisions to it to deal with prescription drug costs or insurance companies that might prohibit certain drug prescriptions from being filled or require other steps to be taken before you can get different medications or things like that?
Yeah, and I'm not going to make the chief sponsor in the House get up and talk, but she did talk about that on the floor of the House. The fact is that step therapy costs a lot more than people, I think, recognize. That the reality is that if you've got to get a lower quality drug and in order to address some challenge that you're facing, because the insurance companies forced you to do that, than what your doctor has prescribed for you, that in the end, that's going to cost the insurance company and the ratepayers and patients, money and frankly, good health care. And so that's why step therapy, for example, deals with this issue by essentially requiring that a certain standard be met by the insurance company when they're evaluating what a doctor has said is required here. And that standard has to be essentially at that kind of medical grade, quality evaluation, something that I think the bureaucrats at the insurance companies don't take into account. Yes, sir.
On behalf of our medical staff, Silver Cross, over 1,000 providers, I really want to thank you. Thank all the senators and representatives who are here today. This is a very important issue for us, and this is really one issue that all our physicians and health providers, regardless of political leanings, we are all on the same team. Because at the end, as you mentioned, it affects us, and more importantly, it affects our patients. So we thank you, and hopefully we'll get this passed, and then we'll celebrate.
Thank you. We have a shill in the audience. Thank you very much. I really appreciate it. Thank you.